Now we move on to UK. The British government will be banning asylum seekers from using taxis for medical appointments starting in February, after a review revealed millions were being spent on transport. An investigation found some asylum seekers were taking long taxi journeys, including a 250-mile, $795 trip to see a GP. The government now says it has been spending around $20 million in a year on transport, with some hotels using taxis for multiple short trips daily. Home Secretary Shabana Mahmood has said that taxis will only be allowed in exceptional cases such as disability, chronic illness, or pregnancy, and must be authorized by the Home Office. Ministers want asylum seekers to use public transport instead and are reviewing all taxi use. The government also aims to end asylum hotels, though over 36,000 people still live in them. Critics say costs continue to rise as the asylum system undergoes major changes. Now for this discussion, we welcome Shruti Das Gupta. She's an international affairs expert, joins us live from New Delhi. Thank you very much, Shruti, for joining us again. Good to see you. Shruti, now looking at this, to what extent does this new transport restriction reflect shifting political priorities in UK immigration policy, and how might they influence relations between government and local authorities?
Well, greetings, Asuma. Thank you so much for inviting me.
Thank you.
What I understand is that UK is ready to overhaul its asylum system, and the local authorities as well as the government institutions, the state machinery, is trying to work in tandem to ensure that public services are available without being cruel or unnecessarily too strict on asylum seekers, while ensuring that fake asylum seekers are escorted out, as well as a burden on the system is kind of eliminated. And this particular law that we just spoke of, the rejection of taxi rides, until and unless it's absolutely required and with direct confirmation from Home Office only, is part of that policy, which is going to ask asylum seekers to take a deeper look on whether they are a productive part of the economy or a burden on UK's system on a whole. The incidents that you have mentioned, some of them where they would take taxis just a two block distance, also multiple times a day because the taxi ride was free. So I believe a taxi driver came up and said that at the rate that he was transporting asylum seekers to hospitals, he was earning £1,000 a day just by doing that much. So it's just one taxi driver in London is giving you these kind of feedback. So it shows that the system was being used by the asylum seekers, misused by the asylum seekers, and the goodwill of UK and its state machinery was being tested. And now with a £15 million bill to just taxi rides is something that shows that there's a deficit of trust now being steadily built, and asylum seekers on a whole will be asked to take a deeper look on whether they are an asset to UK or not. If they are not, they will be kindly escorted out, as Shabana Mahmood has already started offering £3,000, I believe, to those who are willing to go back to their own nations rather than stick around and enjoy the hospitality of UK.
Right, and you know, like the goodwill of UK's government, it seems like it was abused and misused instead of being effectively used. How are these asylum seekers affecting the broader debates on the balance of, you know, between the cost-saving measures by UK now and the humanitarian obligations of UK's government toward these asylum seekers?
So let's just talk a few numbers first. So in the last 12 months, from 2024 to 2025, let's say September to September, August to September, then there's been a 13% hike in the number of asylum seekers. Now, usually you would consider that asylum seekers are people coming from boats fleeing their nations, but of the 13%, that is more than about 1 lakh people were given asylum in these 12 months that we've been talking of. Only 41% of them were coming from small boats. Others were people who came on other means to UK, and then they claimed asylum to claim citizenship under the asylum law. So there is a larger game happening where they are abusing the asylum laws to gain residency, to gain support systems, and UK is waking up to this reality. Beyond just this, if we look at it, the population of UK has risen from 81 million to about 86 million, I think, the span of about 5 years. Just give me a second, I'll get that figure for you. Yeah, in
Thank
2 years, from 2023 to 2024, there has been a major hike. And that hike is disproportionate because the number of white British is reducing. So the birth rates of white British is reducing. The birth rates of asylum seekers is on the rise. One man comes in, seeks asylum, and then because of the family laws, he brings in more people to come and live with them. So UK is slowly and steadily phasing this kind of asylum out. They are saying that they will put an end to hotel asylums also. So there are about, I think, 36,000 people still living in hotel seeking asylum, and that is a huge cost on the economy itself. An economy whose GDP is under question, is not doing too well, and they need working hands rather than a population that lives on handouts. The entire game of asylum was only to ensure that there is a larger population reversal happening, and
Yes.
it is so that the declining population rates is met with people
Yes.
coming and wanting to be part of the workforce. But what they've invited are people who are willing to live on handouts, and that is not good for a country with already a strained system, with aging populations, and with a demographic crisis at its hand, with the rate of asylum seekers that are coming in. So
Yes.
there is a larger question at play, that it has been abused, the asylum game as such, and hopefully the new policies of not giving residency till the 20-year period is up. Only those having work asylum and study asylum will probably be allowed to bring their families in, and renewal of the policy, and as well
Yes.
as asking
Should.
those whose nations have found peace from whatever conflict they were facing at that particular time to go back home. All of these policies will slowly phase out the load on the system, and hopefully UK would be able to breathe soon.
Yes, with that, I would like to thank Shruti Das Gupta for joining us today and sharing that insight. Thank you so much for the exact